In partnership with the Urban Coalition for HIV/AIDS Prevention Services, the National Association of County and City Health Officials, and the San Francisco Department of Public Health, NASTAD is thrilled to welcome you to today's webinar, Benefits and Best Practices Leveraging E-Learning Modalities for Tailored Technical Assistance Needs. During our time together, we will be discussing the benefits of utilizing electronic technical assistance modalities to meet the unique needs of health departments across the nation. After our presentations, we will have some time at the end to go over questions, create dialogue, and have a forum to discuss the needs that you are all facing. My name is Wrapup Shah, Senior Associate on the Prevention team here at NASTAD, and I will serve as your moderator for today's session. I'm thrilled to be joined by our two guest speakers, Ms. Lisa Silverman from NATO and Mr. Gary Naharis from the San Francisco Department of Public Health. Before we go into formal introductions and dive into presentations, I want to cover some logistics and give you a little more info about the session today. You're welcome to use the audio connection on your computer or dial in. The call-in number and the webinar ID are on the screen. We've asked our presenters to keep their presentations brief, so we have quite a bit more time for discussion, but given the number of participants on the webinar, we're going to ask you to submit questions for our presenters using the Q&A function, which is to the right of the menu bar in your Zoom window. If you don't see it, it might be under the More icon on the right-hand side of the menu bar. If you're experiencing any other audio or visual technical difficulties during the webinar, please comment in the Q&A function on the right, and we will do our best to address your concern as promptly as possible. Finally, out of respect for our presenters and participants, we kindly ask our speakers and listeners to mute themselves while others are talking during the webinar. Today, we will discuss the benefits health departments face by leveraging electronic technical assistance platforms as a vehicle for capacity building assistance. As health departments begin to seek cost-effective methods to build capacity, modern systems that optimize efficacy without sacrificing quality require further exploration. Our experts are here to help. Health departments have novel opportunities to engage targeted populations with mechanisms that prioritize value and emphasize impact. This session will examine the benefits of electronic technical assistance in relation to the unique needs of health departments across the nation. As such, we hope that you will leave our webinar today with an understanding of the fundamental competencies behind e-learning modalities of technical assistance that optimize efficacy, reduce waste, and prioritize needed support. We also hope that you will be able to operationalize best practices among health department staff to more accurately meet the needs of target populations within a specific jurisdiction and disseminate lessons learned with interested parties to continue identifying gaps that may arise in implementation or staff uptake. So without further ado, we are thrilled to be joined by today's speakers. Lisa Silverman is NATO's Senior Education Specialist. In her 5 years at NATO, Lisa has worked on training new local health officials, implementing a curriculum for using PrEP for HIV prevention, leading webinars and workshops for rising public health informaticians, and other assorted training projects. Lisa is NATO's lead on many in-person workshops, both in and out of her current portfolio, and is often called on by teams across NATO to develop and support instructor-led training and curriculum development. Lisa holds a bachelor's degree from Temple University and a master's degree from the Ohio State University. In addition, we're joined by Mr. Naharis, who brings over 20 years of experience in public health, policy development and implementation, community organizing, training and technical assistance, and public health and private sector management. He previously directed the Community Transformation Initiative for San Francisco, a 3-year project to transform places and empower people to reduce heart disease and stroke. As director, Mr. Naharis oversaw the management, implementation, evaluation of the initiative, provided training and technical assistance to 14 partner organizations and 23 members of the SFHIP Steering Committee, and managed the initiative staff. Mr. Naharis also developed and managed the Prevention Hub at the County of Marin's Department of Health and Human Services. The Prevention Hub is a cross-collaboration of all the county's prevention efforts, all working together using the collective impact model to reduce injury and chronic disease in Marin County. Gary holds a Bachelor of Arts and a Master of Social Work from the University of Connecticut. Thank you both for joining us today. And with that, I'm now going to turn the floor over to Lisa.
Hi, good afternoon. Thanks, Wrapup. My name is Lisa Silverman, as you mentioned. And can we advance to that next slide? I got it right here. Like I said, my name is Lisa Silverman. For those of you who don't know NATO, we are the National Association of County and City Health Officials. And my role on today's webinar is to kind of set the stage for what we do with e-learning and where it fits. I'm going to leave this slide up here for just a second, let you all take a look at it. As you can see, all of these different ways that we do learning. So take a look at it for a quick second, see the different things. This is the Enterprise Learning Framework. It's designed by Burson, and what they looked at are the different ways we learn. There's what comes from the organization, so in our cases, the county, city, state health departments, and what comes from the learners, what is formally developed, and then what's kind of ad hoc that might not have anything formal. I'm going to get to where e-learning fits at the end. I'm going to work backwards. The ad hoc learner-driven stuff, those are those instant messaging, the social networking things, the blogs that people just sort of put up there because they know it. The ad hoc organizational driven is where we have things that come from the organization. We have our formal communities of practice, we have mentoring programs, we have job shadowing programs. The learner driven and developed, that's where we get to those learning portals, we get to the job aids, those things that people really need to have at their fingertips to do their jobs well. I am guessing that many of you have on your desk something that helps you do your job better, be that somebody's phone number. If you are in marketing communications, you might have some color schemes easily accessible. I like to keep my running to-do list. Those are the job aids. Finally, I'm taking us into the developed and organizational learning. This is our what we consider formal learning programs. This is our classroom learning, be it in person or virtual, and it's our e-learning platforms here. Setting the stage next is the 70-20-10 learning framework. There's some belief that really most of the learning, 70% should be on the job learning. We know that's where learning happens. We know in public health that people get their public health degrees or their other degrees, but the real learning happens when they're out in the field, when they are seeing clients, when they are doing the lab testing, when they are testing water, when they are talking to somebody, talking to a new mom about what her options are for planning her family or breastfeeding. We know that 20% of it comes from what we hear from our peers. So those brown bags, if you're doing them, they're really effective. They allow for that. Any kind of mentoring that we're doing is also important. And a mere 10% actually comes from the formal education here. This is the time when we're in front of the classroom or when we're teaching a webinar just like this. But this really should be 10% of your time. You should go back and talk to your peers about what you learned, and then you should go try to implement a webinar after this. So you might be saying at this point, okay, we have all these different types of events. What are they? You can see, even in a distance learning opportunity, I often separate, do we need to do a webinar where people need to be live so they can be asking questions? Or do we need to do a webcast where somebody just needs to get the information? I'm going to ask you to respond in the chat box. How many of you have ever been on a webinar that's bad, where you just thought, I really just needed to get that information in some other way? Oh, didn't mean to do that. And I want to look at the chat box and see. Frequently. Caitlin, you're saying frequently. Yes. Yes. Many of you. So add to me in there. What makes a webinar bad? What happens in that webinar? I'll give you a minute to respond. A lot of reading. We're going to try not to do that today. Lack of engagement with the panelists. Also trying not to do that today. repeating slide decks. Yep. Yeah, so when we think about designing our virtual events, we have to think about how does this information need to get across? So where are we doing e-learning versus the online discussion? We're having an online discussion right now. We're all talking about the same types of things, but we're having the online discussion. An interactive e-learning lesson lets you put in quizzes or scenarios, or it will show you a video. Self-paced is people do that at their own time. So I have health officials who will tell me, I don't have time to get to something during the day, but I can do it at night while my kids are doing their homework. We have video classrooms. We could be showing you our video here. We're not, partially because we know with limited resources, we often don't want to use the bandwidth. So we have to be conscious about that. We know that many of you at local health departments have the technology you need, but maybe it's not quite the technology you want. Does that resonate with anybody, where you have what you need to get your job done, but maybe not quite as high tech as you'd like to do for really improving things? Yeah. We recognize health departments, governmental agencies are not always resource rich. So as we think about what can we do, we think about where do we put in our video classrooms? Where do we put in our electronic simulations? Where do we do mobile learning? Depending on your health department, you may be a person who's out in the field, and mobile learning may be better for you. If you are in HIV prevention, it may be that you're not at a desk all day. You may very well be out in the field, so mobile learning may work. However, if you don't have a smartphone and you're out in the field, mobile learning has to take a pause. On our next slide, you can also see another means of looking at how we have e-learning methods. So we have scenario-based, where I say, Joe came to the clinic and this happened. How do we solve the problem? We do gamification, which is where we put a game up. I will say, check these 3 things that work. We'll do workbooks. We can say, in your book, whether electronic or on paper, try this. Simulation, we attempt at it. We attempt at showing you the actual situation. Social learning, we're going to do it through a Facebook group or through Twitter. We're going to have a discussion through Twitter. And it includes interactivity. Trying to take a look at the Q&A. Yes, cool. We are getting this here. Nice work. Thank you for engaging with me here today. So just talking to you about the next slide is the benefits of e-learning. On an organizational level, e-learning is expansive. For those of you who are in large states or where your members, where your participants in this are so far away. I know of a county in Utah where the preparedness coordinator actually has to drive 8 hours to get from one side of her county to the other. She can actually reach people if she does e-learning, if she does an interactive webinar or some e-learning lesson. We can also track participation, and in the long term, it may be a cost savings. It may be a cost savings in the short term, but there is an investment, and we'll talk about that in a minute. For the learners, they can really determine their own content. You can determine, do you want to be on this webinar, or do you want to be doing something else at your own time? They can determine their pace. In an e-learning course, people can go back and they can look at something over and again. If I'm teaching a case on public health law and we need to see whose partner do we tell about an infection, I can go back to that module. And it does not require travel. When budgets are constrained and when time is constrained, not having travel is important. In the chat box, can you tell me some of the benefits of e-learning that you have seen or heard, or that you might think exist? Increased attendance, absolutely. Absolutely, it looks like we have about 30 people on here, larger offerings of training. Yeah, we can put together more courses. I'll talk about NATO University in just a minute and what we have on our systems. Anything else? Sometimes you can get higher level speakers. Sometimes it's a whole lot easier to ask somebody at a high level to be on a device at a computer for an hour than to come to your meeting. They might have to travel all day to get to a meeting. Whereas if I just say, hey, can you call in for this webinar? Can you call in for this event? They're happy to do that. Agency buy-in. Yes, staff does not have to leave the office. That's human resources time there, Caitlin. You're hitting the nail on the head there. That is exactly it. Oh, I can be behind my desk. Even me being right here, right now, I happen to be a telework day at home. I'm at my home computer. This was not a big lift for me to be out of the office at all. Had we all been meeting in person for a 1-hour talk, I might have thought twice about it. I'll let you continue chatting in there. I tell you about how we got our e-learning systems started. Can somebody move the slides back for me, please? Because I seem to have a trigger finger there. Thank you. Thank you. So getting started with e-learning. If you have never done e-learning, here are some of NATO's tips to get you started on e-learning. First, you want to assess your needs. This is a huge part of things. We know we do this with any public health project. We assess the needs. What are the learning needs of the community? In some communities and some audiences, people need to come together. They want to be in person. In other times, people need the flexibility. You also want to secure the long and the short-term funding, making sure that you have that. NATO put out a good chunk of money at the beginning, and we still pay several thousands of dollars a year. And you need to make sure you have the additional staff or contractors on site. We move into the development stage. This is where you're developing your learning management system, you're matching it to your needs, you're determining your evaluation process. You want to start this early, and then we're testing the courses, we're seeing what's working. Finally, is when we market and we launch and we continue to evaluate. We are making sure that we know what we're doing and that we know we're doing it well. I want to spend just a quick minute telling you about NATO University, which you can get to from the NATO website. We developed NATO University right around the time when I came to NATO, and we said we needed a way for our members who are all across the country to be able to talk to each other, to be able to learn together, and to not have to travel. We recognized that the travel time was a big deal. We also needed a way to know who was doing what learning. So we're able to offer about 30 modules. We offer them all across our teams. We worked on environmental health. We have a new module up there on health and disability. We have some health equity there. We work with a provider. We've had that provider, Blue Sky eLearning, and we make sure that our courses are both SCORM compliant and 508 compliant. The 508 compliant is the compliance for people with disabilities so that they can have full access to the course. Our e-commerce allows us to charge our members for those courses. It allows us, we do not at the moment, but it does allow us to charge if we wanted to. It's a potential revenue builder for us. And we do have a single sign-on with NATO's association management software because our members do have their own logon into our into their NATO website and their NATO portfolio with their applications for awards, their work groups, things like that. We wanted to make sure that it was streamlined, one single sign-on. I'm happy. I know we're going to take questions at the end, but if anybody has any reactions right now, happy to take those. If not, I can turn the floor over to Gary.
Well, thank you so much, Lisa, for your insightful and in-depth look at the infrastructure and basis for e-learning as a useful tool for health departments. Moving on, Gary, I'm going to turn the floor to you. Hi, Gary. You might be muted. Could you just check that?
Oh, can you guys hear me now?
Yeah, perfect.
Go ahead, Gary. The floor is yours.
Yay. So please feel free to go to the next slide. And what I'm going to be sharing today is really some of the experience that we've had at our health department in the capacity building assistance work that we do, funded by CDC. And I also wanted to just say, pleased and privileged to be on this webinar. San Francisco Health Department, as you know, is a member of NATO and NASTAD and UCHAPS. So it's a real privilege to be sharing our experiences here. So the first thing that I just wanted to share with everyone is this mantra of know your learner, know your needs. And yes, I do sit at my desk sometimes with an aviator hat on and, and get excited about e-learning. But this is the most important thing. I think a lot of bad e-learning that you all have seen and talked about in the chat box comes from just having a funder expectation or just an organizational expectation of what that e-learning should be. But I think you always need to start with your learners and whatever type of learning it is that they want. So whether it's topic, the particular strategy, the particular technology, how it looks, what they like to learn, how much time do they really have, and what are their preferences. So the number one question as you get to know them that you want to be able to answer is how can the skills they want to learn or share, because it can be peer-to-peer, it doesn't always have to come from a health department or another organization, but how can the skills they want to learn or share be best addressed through technology? So a lot of times what happens, we always end up starting with the technology first. We see some great thing online, we hear about a tool that we actually have access to, and then we jump right in. But I think starting with the learners first, because they're going to help you with one really important decision, which is which material do you want to put online, and what do you want to save for in-person, for something like a more interactive discussion, a webinar, an in-person meeting, in-person training, etc. So when we went and talked to our staff, some of the key questions we asked them was what training were they doing that was most repetitive, that would benefit from being online, because it was really time intensive to do in person, but they were just doing it routinely. They weren't maybe as excited about it anymore. Clearly the need is there as there's turnover in organization at the community level or other participants, but having that kind of basic 101 level training may be perfect for online. And then some also just wanted portions of that online so that they could spend the in-person time that they had with folks on more technical assistance type interaction. So then you can look at this technology and say, okay, for the learners that we have, for the topic that we want, for the skills that need to be learned, what is the best technology? And technology can be expensive, time consuming. It can be, there can be a lot of expertise in terms of how to run it. If you can go to the next slide. So what we learned and what we heard from our learners, and then when we made a mix with some of the technology options, we heard basically three different things that folks were looking for. The first being really self-directed learning and really looking at what can be self-directed. These are really bite-sized chunks of learning. This could be 5 minutes of learning. Sometimes it's called just-in-time learning. You can also use storytelling approaches here. This is a perfect opportunity for a video or a brief going out in the field and interacting with folks and getting their perspectives. The second is really more of a blended learning where you do part of the piece online and using e-learning tools and then the rest in person. And I'll give an example of that. And the final is the most intensive, which is the peer-to-peer. And that's where you're really looking at what are things that people can learn from each other that don't necessarily need a formalized training approach, because these don't have to be highly formalized presentations. Next slide. So just an example of the self-directed learning. It's really, there's a narrow focus with this. You might have a multi-step process where you'll need more than one module. That's okay. Folks would rather do 4 10-minute modules than they would one 45-minute module. So being able to break it up and really being able to go to those bite-sized chunks of information when it makes sense. Rules of design are critical here. You can start with a PowerPoint, but you want to make sure you end up with something that's really interactive and engaging. Next slide. So for the blended learning piece, one of the examples was our HIV test counselor training that we do in San Francisco. There was a basic level of information that our staff wanted to make sure that participants had coming into the training. So we moved that portion online. And what it did was freed up time during the in-person training to look at other things. And especially these days with the advent of things like PrEP and Test to Treat with Rapid and changing models of HIV test counseling, you want that in-person time to be as interactive as possible. So moving that piece in advance was great. You can do it in an iterative way. You could have multiple modules in advance, et cetera. Next slide. And then finally, the most intensive was the peer-to-peer learning collaborative approach. And this is really, again, having a user-centered design is essential. Resource sharing, this is where you're building an actual, it's not just a presentation online, but also a community web space where you can share materials and have discussion forums and have active working groups where people are working on things with each other and then presenting it to the larger collaborative. And again, on these, you're not necessarily bringing in experts to do training. The members are the experts themselves. Everyone has had their own unique experiences implementing certain programs, certain skills, certain topics. You want to bring several of those to each call or each interaction that the collaborative does so that folks can hear, oh, here's how they did it in Miami. Oh, and then here's how they did it in Shelby County in Tennessee. And here's how they did it in Idaho or Montana. So you get those multiple perspectives. And then folks are really questioning and sharing with each other afterwards. And so overall, what we learned, and you can go ahead and go to the next slide, some key things to remember. One of the things that we learned about, and just to reiterate, is that know your learner piece, and really look at what problem are you trying to solve. Make sure the learner can answer that question in advance of you building something or creating something. Really choosing your strategy. How do they want it delivered? Is this going to be an online interactive? Is this going to be self-directed? Is this going to be a longer piece? We all know we've had to sit through those forced emergency preparedness and other trainings that have to be a certain amount of time online. And there's good reasons for that, but we know how hard it is sometimes to sit and look at a module for 45 minutes to an hour. So really thinking about those bite-sized chunks. And then the most important final thing to remember is adjusting as you go. We learned, even in the planning phase, you have to get as many people involved as possible before you even plan these modules or choose your technology, because you want to hear from people that are going to be participants and listening. You want to hear from those that are going to be more instructing or sharing, and even those who just need to keep your website updated or your technology tool that you're using. A detailed socialization process is essential. You need to walk people through how to use these e-platforms and e-modules. And that can be, again, a self-directed module unto itself. It could be a webinar, it could be something fun. It could be one-on-one conversation with folks, but have people really engage, do a warm-up discussion thread if you're doing a community, a learning collaborative or a larger community. One of the things that we did on our Pride Learning Collaborative, our fabulous community caretaker in that collaborative, he started the very first discussion thread was, when you have to travel to another city for a conference, what's your favorite city to go to? And what's one favorite restaurant or someplace you like to go in that city? First of all, it was a great resource to watch that thread develop. Of folks, there were all these great restaurants and fun things to do in common conference cities. And then the second thing is it allowed people to participate without having to be an expert on the topic that the learning experience was going to be about. Some people can hesitate to join in because they feel like, well, maybe I don't know as much as someone else, but offering them these different activities and ways to engage is really helpful. And then caretaking, spend as much time as you can making connections and building support. And that comes in many formats, everything from sending welcoming emails to scheduling phone calls with folks to chat about their programs. A lot of times people would continue, for example, to email us questions in these learning collaboratives and say, well, what do you think about this? Or what's the latest science on intermittent PrEP? And, you know, we would say, wow, why don't you post that as a question in the discussion forum? And then see what people say. So you want voices coming from all sides, especially in those collaboratives. And finally, when it comes to resources and sharing materials, less is more. Try to be as intentional as possible. When you're creating folders or making resources available online, people don't want a dump of things, but you know, in our Pride Learning Collaborative, for example, one of the things that people wanted to know was, you know, protocols for developing a PrEP clinic and administering and running a PrEP clinic. So everyone contributed what their current protocols were, whether they were in draft or final or just in an outline or in development. And so everyone got to see and feed off that various information. And then people went back and refined and strengthened their own materials and then reshared them again as they were in place. And then finally, communications. Too much communications is just as bad as not enough. It's always finding that sweet spot with any e-learning piece that you're going to do. So whether it's a series of modules that you're doing over several weeks and you need to be reminding folks to participate, whether it's an ongoing learning collaborative or it's just a once in a while, just in time training, you want to get them the communication around the time where they're actually going to use your material the most. So thank you. I just wanted to acknowledge before we turn it back to our amazing facilitators and take on some questions, a few folks, Mateo Lumbreras, who's our distance learning specialist and who runs our Pride Learning Collaborative. A lot of these insights that I'm sharing with you have come from his experience as well, interacting with this very unique community. And then the rest of our team, Jonathan and Mayrose and Wes, who help. It really takes multiple people to keep these learning collaborations running efficiently, and certainly funding from CDC. So thank you all, and looking forward to the questions.
Thank you so much, Gary. It was a pleasure hearing you share some of your unique experiences at San Francisco, and we're thrilled to learn more about how, you know, nations and health departments across the nation can really implement and sustain some of these platforms. So thank you so much for sharing all this information. Again, I didn't really progress to the slide where Gary got to send some of his acknowledgments. So I'll just take a moment to acknowledge some of these individuals right here, those of you who are able to see that from abroad. So thank you to all of these individuals as well. So before we open the floor for questions and discussion, I want to briefly spend some time discussing some resources NASTAD and UCHAPS utilize for e-learning. Here at NASTAD, our online technical assistance platform, ONTAP, is utilized as one tool we operationalize to conduct TA to states and territories through a variety of our programs. ONTAP is organized as a collection of communities of practice, or COP. And within each COP, you have courses, and some courses have their own modules. This image here gives you an idea of how the platform is organized, and all the users who use this platform have unique usernames and passwords and can personalize their own ONTAP experience. As kind of an example of some of the current COPs within NASTAD's platform, we have this kind of visualization here. You know, each has their own staff that manages this content, TA delivery, and resource sharing. And as a result, we have the capacity to utilize one platform to meet the needs of many programs. These are 3 of our top programs on our platform, and the programs that really get a lot of interface with health departments and staff across the nation. And so now I'll turn it over real briefly to my colleague, Kenya Hutton, the program manager at UCHAPS, to briefly cover the UCHAPS Resource Center. And so Kenya, feel free to take it away.
Awesome. Thank you so much. And thank you, everybody, for joining us in this webinar today. I did just want to quickly let you know about the UCHAPS Resource Center. That's a space where you can find all of the UCHAPS best practice guides, as well as past webinars, and also find out about some of our upcoming webinars. Some of our past webinars include the hidden crisis, opioid and meth use among Black gay men, the U equals U and undetectable, and an undetectable equals untransmittable dialogue, which was facilitated by Bruce Richmond and Dr. Dimitri Lastis from New York City Health Department. And another collaborative webinar done by NASTAD and us as the harm reduction with people who inject meth. Like I said, you can go there and find any of our best practice documents, view some of our webinars, request technical assistance, and we also take suggestions for future webinars that you would like to see us do. If anyone ever has any suggestions on a webinar they would like to see us do or would like to partner with us in a webinar as a participant, please feel free to email me at kenya@uchaps.org. That's KENYA@UCHAPS.org. And again, thank you guys for joining us.
Thank you so much, Kenya. Thank you for sharing this information. We'll just mention we're so glad to have UCHAPS as a partner on this webinar, and a lot of the work that we do here at NASTAD would not be possible without the contributions of UCHAPS. So thanks again for talking about some of the resources that they also have to share. So, and with that, I'll now turn to our Q&A and discussion portion. We'll start with questions that you all submitted through the Q&A tab, and then turn to some discussion questions for our speakers to consider. So first up, I'll start off with some discussion questions here. So this is open to the floor, but to our speakers, are there really any populations within your jurisdiction or in general that might not benefit from this modality of technical assistance? And are there any that would particularly benefit more from this kind of modality? So anyone is welcome to answer.
Hey, this is Gary. So I think that is a very good question. And I think that's why, that essential point of knowing who your learner is and really what they're looking for is most important. So whether you're doing focus groups with folks, certainly, most all of this e-learning is very intensively technological based. So if you're working with a population that doesn't have easy access to technology or is maybe not familiar with using it, that you may want to introduce e-learning very slowly or not at all, depending on what it is that you're trying to communicate and get across. So that's something that I would just consider. The other, I think where this is most useful is definitely with staff, both staff in public sector organizations and private sector organizations, because especially when learning is chunked out and staff can really do it at any time while they're at their desk or even on their mobile devices. A lot of folks are accessing this stuff through iPhone and iPad. And as a matter of fact, I'm doing this webinar via iPhone and iPad. So there are folks who are ready for that technology and more familiar with it or more mobile out in the field. So you want to make sure it works for those platforms too.
Thank you, Gary. Go ahead, Lisa, were you going to say something?
So yeah, I'll chime in here. Gary, I think you made an excellent point by saying know your learner from the beginning. That's just so critical here. I think there are certain people, and I will say this for myself included, who do not always learn. Certain people do find it a little more isolating. Certain people love the classroom environment. They love the focus that it gives them. I think anybody who has two screens can tell you they maybe are not always so focused. So thinking about what the learner wants and what they're open to. On the other hand, I can tell you that my partner is a faculty member at GW working with undergrads, and she says they're the Twitter generation. So for them, thinking about what does that distance learning look like? Is it e-learning or is it a Twitter chat? NATO has some very successful Twitter chats. We know the CDC does as well. So really thinking about what is the need, who is there, what is their want before you say, Gary, you made a really great point. You say, sometimes we get these big things where it's like, hey, here's this cool new technology. We start using it, but we don't think about why are we using it. Similar to how we do meetings, where people say, we should have a meeting, and then I say, why are we having a meeting? So really thinking about the purpose in all of this, and the learner needs. Some of it may be generational, some of it may just be the routine and what people are used to and who is open to learning a new skill.
Yeah, and I would add to that too the opportunity to pilot. You don't have to, everything you do doesn't have to be the be all end all, your best course ever, your most comprehensive thing online that goes out to everybody. Especially if you're not sure with the population, do a pilot, have a couple of folks try it and see what their experience is. And then just one technological caveat that I would throw in is that, you can never assume, even with an organization, the level of technology and access that folks have. So, for example, we have a partner health department, another major city in the US that can't access a lot of our stuff because their own internal IT policies, procedures, firewall prevents the access. And they're a huge health department. So that's where it's like that going to your learner first, piloting, having folks really try it out becomes essential.
Great.
So
Thank
Gary,
you so much.
We see that as well. So if you're going to use Twitter, making sure people can use Twitter. Government agencies do block things. They block things like Dropbox at times. So just being aware of what's where.
Great. Thank you so much, both of you. I want to move on to our next question. Lisa, this is to you. And what mechanisms have you developed or are aware of that you think would be effective to evaluate some of the efforts used by any e-learning platform? And is there any data that should be shared across health departments that would be very valuable for uptake of the system?
So it's always good. We find it's always good to have one standard evaluation that is a couple of standard questions that you will always use for the same e-learning. Some of that's just doing quality control questions. So was the content clear? Was it easy to understand? Do you expect to be able to use the content in your position going forward or in the future? There are a couple of different levels of learner satisfaction and learner action. I didn't get into this in the slides, but Kirkpatrick's training evaluation model is a great one. So first you're looking at the bare bones. Did you like what I taught? Could you hear my voice okay? Did I go too fast? What was the speed of the webinar? After that, we go deeper. Did you remember it? What actually happened? Then it goes to, will you use it? And then it goes into the, okay, what actually happened because of using it? So you kind of want to think about your evaluation question from the get-go of where is it important for you to get the information? Along with that, you also want to consider when can you get that best information? So at the end of today's webinar, you can probably answer the question, did you like it? Were you satisfied? Did it meet your expectations? Could you hear us okay? Were the slides clean and clear? Were they free of errors? It might take you a couple of months, possibly even longer than that, to say, yeah, I can actually do something with this material. Or you said something that made me think about this. You might not see that today. You might not see it this week. But ideally, hopefully in a couple of months, I've said something that makes you think twice. So planning your evaluation as much as you are planning your courses will help a lot. They should go hand in hand. As the trainer, I am working extremely closely with my evaluator. Basically, from the start that somebody says to me, we need to do a training, I say, okay, so we need to have an evaluation with it. We need to know what we're doing well and what we want to get out of this.
Great. Thank you so much for sharing. Gary, this next question is for you. You mentioned that in San Francisco, there's a portion of your HIV counseling and testing training that is blended. I'm curious to know which portion is an e-learning module and how you kind of decide which one to use where.
Oh, great question. Currently, it's some pre-course work that's online. It's really the basics of HIV and AIDS. So there are some basic information, definitions, essential things that would demonstrate to our trainers that folks have some basic level of information coming into the test counselor training. And so what you can also do is use those modules as screeners, because you might want to say, oh, well, if someone doesn't have this certain baseline of knowledge, then maybe they're not ready for the full HIV test counselor training yet. And rather than investing 4 or 5 days of that intensive in-person time with someone who maybe wasn't ready and needed to build other skills first, you can do that. And so knowledge checks become an essential part of all these aspects of e-learning, and building those in wherever you can. A lot of times when we're, again, we have to remember to take user-centered approaches here. A lot of times when people develop modules, they always want to put quizzes and tests at the end. And I think we have to remember, with adult learners, we're not quizzing and testing, we're not in school, but it's a knowledge check. It's, did you retain the information, or do you have the knowledge needed to be able to move on to a next stage? Are you just ready for the next piece of learning? And so some of that pre-module on the basics of HIV and AIDS, there's a knowledge check afterwards, and you have to score a certain number on that knowledge check to be able to then participate in the full in-person training. So there's multiple ways you can use it. It can be as formal as that, where you have to pass this knowledge to get in, or it could be informal, of like, we don't want to spend a ton of time going over the basics, so here are the basics. Please, review this and then come in ready to go, so that we can move on to more interactive things.
Wonderful. Thank you so much for sharing, Gary. Our next question is open to everyone. What is kind of the first 3 concrete steps outside of evaluation that could be very useful to begin an endeavor like this? A lot of health departments are very curious to know, how do we start? How do we get this off the floor? What are some things we can do tomorrow to get this moving? Evaluation aside, what are some of the things programmatically, cost-wise, that we can do, and 3 easy steps that we can take to kind of move this forward?
So Gary started and I can't stress this enough, know your learner, know their capabilities, know their needs, is my big first one. I know that I have health departments where if I ask them to travel, say, to Atlanta or to Washington, D.C., where we're located, it's going to take them a day of travel, and they're going to arrive exhausted. So knowing where they're coming from geographically, what allows free learning, also then knowing, do they have good internet? Or is this something that you should send as a job aid, because they can receive emails a whole lot easier than they can have good internet access in a place like this? Gary, my other thing, and I don't know if you can address this better, is securing funding. And I think you can address that better on a health department level. You can do e-learning on the cheap, but you are doing it on the cheap, and you kind of pay for what you get. There are a lot of fancy bells and whistles out there that you may want, but being clear about your budget in public health, as we're funded kind of program year at a time, know where the long-term funding is going to come from. Because it's nice to be able to invest it all. It's nice to be able to put $30, $40, $50, $100,000 into a system to begin with. But if you don't have the sustainability funding, you're kind of going to have a year, you're going to build a pretty system with bells and whistles, and then you're not going to be able to continue it. So those are my 2. I think those are the most important 2.
Yeah, and just to echo that second point, one of the things we heard from learners when we went to talk with them across the board, no matter what the topic was, when we were talking about them about needing to use an online system for anything, their number 1 piece of feedback was, please let this be stable over time, because I can't keep learning something new every single year. And for every organization that I interact with and every person that wants me to do a training, like, I have to learn a new system. And so realize that that's what a lot of your learners are going to be faced with. And, their thing was stability. They want to know, is this going to be around for a few years? Because I'm not going to invest my time sharing resources and having discussion forums and doing all this peer-to-peer learning, and then it disappears after a year or 2. So really being able to think out the long term as you're building your program. I think, again, this all goes back to the knowing your learner and their needs. I have been surprised at some of the topics that people have been ready for. It's definitely not things that I would have even known about, much less been able to pick. But, we did a thing with staff internally in our health department, because we actually have a learning management site, and it really is just a website built in WordPress. It's not the website itself, and being able to host courses is not really that expensive. It's the quality of the course that you create. That's where you invest your money. It's in that module that gets created, whether it's 5 minutes or 25 minutes. That needs to be visual and interactive and have good voiceover and not just be a PowerPoint online. So that's where you're going to find yourself spending the most amount of money, really, is creating quality, engaging, and interactive learning content. But we had like 18 staff from all over our population health division, came environmental health, community health equity and promotion, equity and quality improvement, across the board. And the first person that was ready for a course and whose learners wanted the course the most online was on backflow prevention. And even in public health, I had to remind myself back to my environmental health classes, like, what is backflow prevention? And I'm like, oh, that's how the dirty water in a building doesn't get mixed with the clean water in a building, and there are certain procedures. And what they were doing was an in-person training on an annual basis with all these backflow technicians and all these organizations around the city. And the technicians themselves said, we don't want to keep coming in person to this training. It's not worth coming for a whole half a day, for just the travel across the city and settling in and then learning and then having to get back and time away from work. They're like, just give us a module where we can see a video and just see what needs to be done, and we can certify that we've been through it. So, some of the most surprising things come up when you do that focus on listening really to your learner at first. And often the things aren't the fanciest. Some folks might just be like, I want to know just how you develop some prep materials, or I want you to walk me through your prep key messages, or whatever it might be.
Wonderful. Thank you so much for sharing. On that note, can you just kind of talk a little bit more about how, in San Francisco and areas and communities that have implemented some of this, how you've been measuring impact for your population, and what that impact has looked like over time and how it's changed? I think a lot of health departments are curious to know whether or not the way this affects their communities is not necessarily a static situation, and it can change over a period of time. And so a lot of people are, wondering, is San Francisco measuring differently from, year to year, month to month? How does that look for you guys?
That is a really good question. So one of the most important things for us, and we've talked about, I think, already on this webinar, like you're always going to ask those questions and get that data about, was this a good presentation? Were the materials quality? Did you learn something? I think that unless you develop something really bad, most people's answers to those things are always going to be yes. Like, someone's always going to have learned something. It may not have been exactly what they wanted to learn or everything they needed, but everybody learns something when they participate in a webinar or any learning module. What we also started asking in the questionnaires that we put out, especially with these highly interactive like learning collaboratives, is going into that question of, is what you learned impacting your practice and your organization? So are you actually doing something different in your work in some way because of your experience here? I got a program started faster. I didn't have to create a protocol for my prep clinic from scratch because I was able to start with someone else's. That accelerated my time frame of being able to get things up and running. And then, has it impacted your organization? I know one of the things that we heard from our peer-to-peer learning collaborative in the assessment that we did was that they felt a lot more engaged and reported some better engagement with the actual target populations that their grant was focused on working with, because they heard such specific ideas and examples from peers in other similar settings. So it made them, I think, less apprehensive or less nervous to try things, and then more successful when they did. So we, in addition to, you know, these on-the-spot evaluations with a particular module or a particular session, we've done these more intensive, in-depth assessments kind of 6 months into the Learning Collaborative, and then we'll do it again a year into the Learning Collaborative to really look at the impact on practice and the organization itself.
Well, great. Thank you so much, Gary. And thank you, Lisa and Gary, for providing some really insightful answers to these questions that we've been getting. I want to, you know, we're running a little, you know, close to the end of our time today. So I want to, you know, thank you to our partners. I want to thank the Urban Coalition for HIV/AIDS Prevention Services, the National Association of County and City Health Officials, and the San Francisco Department of Public Health for having this dialogue and for talking with us today about some of these really important concepts. We would not and could not have explored really or understood and engaged some of this material you know, without your support and time. You know, NASTAD is really thankful to have started this important conversation on a topic of growing influence, and we look forward to continuing this dialogue so that health departments, community advocates, and staff have the tools they need to deliver the modern TA that really optimizes this time. You know, before we leave today, I want to, you know, offer some final resources and, you know, talk about some next steps. But is there anything else that our presenters or panelists would like to comment on before we close out?
Hey, this is Kenny from UCHAPS. I just wanted to direct everyone's attention to the chat box. I just sent a link for a quick 3-question, 30-second survey just to get your thoughts on today's presentation. If you have a few moments, just go ahead and just read some of those 3 questions. Thanks.
Thank you, Kenya. Do any of our additional panelists, do you have any other comments?
Nothing from me. Thanks for the invitation. It was great chatting with everybody today.
Yeah, and this is Gary. Thank you so much for having us and for creating this partnership to talk about e-learning, and happy to follow up with folks if they have questions after the webinar as well. Feel free to email anytime.
Well, wonderful. Thank you both so much. I'll just wrap up with letting all of our participants know that you can access the full presentation and a recording of this webinar, and as well as any of the relevant materials we talked about in our chat box today through NASTAD's online technical assistance platform and the UCHAPS Resource Center. If you don't have an account with ONTAP, please don't hesitate to email us at ONTAP, ONTAP, @nastad.org, and we will give you access. In addition, if you need support accessing the UCHAPS Resource Center, please reach out to Kenya at Kenya, Kenya, at UCHAPS, UCHAPS.org, and he will be happy to oblige. If there are any other questions or comments you'd like to share with us, any contributions you'd like to make, please feel free to reach out to vshaw@nastad.org, and we'll respond accordingly. So with that, again, I want to thank everyone of our presenters, all of our partners, and especially thank you all for joining us today on this Tuesday afternoon. On behalf of everyone here at NASTAD, we hope you have a wonderful day, and we look forward to deepening our partnership and work with you in the days and months ahead. Take care.